Okay, so Veva and Brandie, I'm so glad that you could join us. We are having a brown bag series. This is BMSG's present to itself to celebrate our 20th anniversary. So we are inviting people who we want to hear from, who we want to learn from, talk to us about their work and how it relates to media advocacy. And we have the staff around the table, and over here we have Brandie Banks-Bey, I had to ask her so I didn't say Bay Banks, who's the communications strategist who's going to be with us for a little while, has to leave in about a half hour, I think. And then Veva Islas Hooker, who is the director of the Central California Regional Obesity Prevention Program. And the thing to know about their work is that, one, it's outstanding. They have really put the Central Valley on the map on this issue. And Veva recently won the Media Advocacy Award from the Strategic Alliance. So not only are they going to talk about media advocacy, they're going to talk about award-winning media advocacy. So take it away.
Okay. So I want to take you back to the Childhood Obesity Conference where I was awarded this. And Lori wasn't in the room when I gave my acceptance speech, so I kind of want to replay that for a second here. So thank you, Juliet. It's an honor. It's an honor to be recognized. I think everybody appreciates that, but it's doubly more of an honor when your peers vote for you and recognize you. And so I want to say thank you. And there are three people in particular I want to thank. I want to thank Brandie Banks-Bey, and I actually want to share this with her because without Brandie, a lot of my efforts to try to get in the media would not have happened. And I want to thank Lori Dorfman because not only does she have great hair, she's an exceptional trainer and mentor and teacher around media advocacy. So I really feel like if I've been successful, it's really been because of Lori's investment in helping me be successful. So thank you for that. And lastly, I want to thank my mother because it was my mother who originally got me to be an advocate. And that was as an interpreter during healthcare visits and social service visits for family members and friends, where I really began to see the issues and the challenges that my community was having. And I didn't always want to do this work. I remember a conversation once where I told my mom, I don't want to go to another, medical appointment and wait, for hours and then say 3 sentences and then, a 2-hour drive back. And she stops me and she says, Beba, God gave you 2 hands. You use one hand to help yourself and you use the other to help others, right? And so it's been sort of because of that guidance and that mantra from my mother that I think I really did become more involved and chose public health as my path. And the last thing I said when I was accepting this is that we as a community of public health have to do a lot better about telling our stories because our failure to tell our stories means that somebody else is telling those stories and that somebody else's perspective on our issues is being framed, right? So I really just encouraged everybody to do that. So all joking aside, I think that in this idea of trying to create more people who use their voice to support public health issues, there's not a magical formula, but at least for me, in my experience, I can speak to the sort of 3 things that really helped get me out the gate, so to speak, right? And so one of them is this idea of harnessing your personal experience and telling your story through your personal experiences. And that's not hard. I think all of us can talk about how, well, in my case, growing up in a non-English proficient household affected me, and how not being of higher income affected, the type of health care that we could access, right? Or the lack of health care that, we couldn't access. And so relating your experience, I had a question once about water and water access. And in the Central Valley, there's been a lot of predatory marketing of water filtration systems in places that have perfectly healthy tap water, right? And it's sort of this sort of fear of there are places with poor water quality, so every place has poor water quality. And people want to protect their families, and so they, like what happened with my family, my mom and dad bought a $5,000 filtration system when their average annual income when I went to college was $13,000, right, combined. And all it was a water softening treatment, right? It did nothing to filter. So anyways, I could relate that to the issues of, why people need to be more informed about their water quality, and then for the obesity prevention, how we really need to make water more accessible because of sugar-sweetened beverages really perpetuating, unhealthy diets. So harnessing our experiences to tell our stories. I think the other thing is having some investment. And for me, when I came onto CCROPP, we had the academy that really helped us identify how we talk about obesity, what are the opportunities for us to continue to get the message so that more people understand, and through that we're garnering more support for our efforts. And so that just doing that more consistently, but having the wherewithal, I didn't know an op-ed probably before that, right? And then I understood that, and I understood also just the power of the conversations, how the conversations you're having as you're presenting, the dialogue that you're introducing, also helping to inform public opinion and public ideas, and how valuable that is. So that came because of the investment in training and information and capacity building. So I think that's another critical element as we try to get more people to take these steps. And then I think the third thing is about relationships. So relationships with the media. I can tell you, before I started this work, I didn't know who, the health reporter for Fresno Bee was, who was that person in Stockton, who was that person in for Vida en el Valle or La Opinión. And now I know all of these people by name, right? And I know these people when I'm at meetings, and I'm in a position now where they'll call me and say, hey, I want to work on another story, and you've always been a great source of information. What do you think is the next story I really need to look at, right? And that's power. That's valuable. That's because of being able to articulate your message and your truth about what's going on in your community. So I wanted to talk a little bit just to about, I know where I want to go to, about telling the story a little bit more deeply, allowing yourself to be vulnerable, and how powerful that is. And so in 5 minutes, I want to share this story with you rather quickly. So I'm a middle child in my family. I have two brothers, Francisco and Victor, and one sister, Magdalena. She's the oldest. And I was the bane of my sister's childhood. Of probably her whole childhood experience, because my sister was such a great kid that everyone loved her. I'm talking about the teachers, the mailman, the grocer, anyone who ever had any experience with my sister, just loved her. She exuded this just, I'm a wonderful person type, and I never could compete with that. I always would get oh, you're Mary's sister? Oh, really, you're Mary's sister? It was always that type of reaction. And so I felt my sister owned being good. She had 3 years ahead of me to win over everyone in our family. And there wasn't, my only shot of being able to get attention was that I was going to have to break her, right? I was going to have to show that she was not perfect in some way, right? So that people could be oh, she's not all that. So this wasn't any type of ordinary sibling rivalry. This was a mission for me. I would be tactical about how I wanted to deploy this. So here's sampling. When I would introduce my sister, I would introduce her by her full name. And her full name is Maria Magdalena, which is Mary Magdalene, right? So I would introduce her as, this is my sister, Maria Magdalena, the biblical whore. And that didn't always go over well, obviously. Or things we would be, sitting with our family, and I'd have some cookies, and she'd ask me for a cookie, and I would lick the cookie before giving it to her, just to see if she would react in front of my parents, and she never did. Or worse, when we're in high school, I would make sure to get up earlier to take my shower first while my sister was ironing her clothes. So when she got into the shower, I would put on the clothes she just ironed and go to school, right? That would be some of the the caliber of my pranks that I was doing, right? But my sister was always just the sweetest, pacifist, person who she might get mad, but she never would blow up, and she was never really gonna, hurt me, or I think I would have done had a sibling of mine done that to me. So this is like how my childhood was. I was always pulling these pranks on my siblings, my sister in particular. And then I wasn't really getting any progress on my mission to break her until like this one thing happened where my sister actually got the better of me, and it went down in family lore as like the one time any of them really got me. And this is what happened. So we're in high school, and my sister got a boyfriend. His name was Pablo. And Pablo would call religiously after school, right? And they would be on the phone for hours. My sister and I don't really resemble ourselves. She's taller, she has freckles, her hair's darker. I mean, you can tell we're sisters, but you know, there's the height difference and stuff like that. But on the phone, we're identical, right? Our voices are like, our parents can't tell us apart. Our brothers can't tell, aunts and uncles like will call us this Veva, this Manana Veva, you know. And so anyways, the phone rings and my sister wasn't home. And like, I go to answer the phone and I know it's Pablo, right? And so I answer the phone and like, I'm about to tell him, oh, she's not home yet. And then this sort of like, supernatural demonic possession takes over me. And I'm on the phone with him, and I can't repeat everything I said, but you know, just suffice to say that by the end of the call, he was very excited. And so, you know, this, obviously, you know, I had set in motion this sort of plan that this was, if anything was going to break her and she was like going to go off on me, it was going to be this. And so I was, all that night, I remember just being like, so like thrilled about this plan that I had put into motion that I was smiling every time she came into the room, right? Or I would laugh, you know, just like, you know, it's gonna happen tomorrow. And so, of course, the next day there was this really like great confusion, and she was like, oh, I didn't say I was going to do that, because, you know, my sister was an angel, and she was, you know, a bit of a damn prudish angel. So nothing like that was going to happen. And so, you know, so yeah, it took them a while to sort of like, no, that wasn't me. It was Veva. It was Veva. And so I'm at home like waiting, like she's going to like blow her stack, you know, and I'm in the living room, and my sister walks in, and I remember looking at her in the doorway, and she's looking at me, and I know she knows, and she knows that I know. And she had this like expression that it wasn't angry, it was like a confusion that scared the shit out of me, because I don't think she knew what she wanted to do to me, but I just knew that because she was confused, she wasn't going to be an angel. So I ran to the restroom thinking like, you know, she's going to hurt me. And I waited there for her to come to me and just like beat down the door, and she never came. And I can remember opening the door and like checking, like, is she there? Is she not there? Is she there? And so anyways, I gave up, like, she's not going to attack me. She's not screaming. She's not crying. I can't break her. So I decided, well, I'll just go to my friend's house to go do my homework. And I walk through the living room. I grab my bag. I go out the door. I get to my friend's house. And I'm telling my friend, like, how disappointed I was that she didn't, like, just go off on me. And I reach into my bag to get my book, and I feel something mushy in my bag. And I open my bag, and my sister has taken the whole pot of oatmeal that my aunt made that morning and poured it into my bag, right? And she got me. Like, that was like the payback of all paybacks, because my yearbook was ruined, my homework was ruined, like everything was ruined. Like, and in her just like pleasant demeanor, she really like got me back. And I miss my sister. I miss talking on the phone for hours and smiling and laughing. She died when she was 39 years old from cancer. And being 44 now, it's really strange to have outlived your oldest sibling. And when she died, she left behind her husband, her 3 children. She never got to meet her grandson, Ian. And true to form, like my sister's dying from cancer. And we're talking about like all of these crazy things I used to do to her. And she's not upset. She's just laughing about them as like this really hilarious childhood experience. And I did get a chance to like tell her I was sorry for being that spoiled brat, right? And she was very, very forgiving, which she taught me a lot, you know, in that. And she was, you know, grateful for her family and her experience, and of course would have loved to continue to live. And I think that it's been those experiences in my life that have really gotten me to understand how important public health is, because I believe that sisters should be able to grow old together, right? I believe that when you find the love of your life, that you should live the rest of your life with that love. I believe that daughters should be able to grow up with their mother's loving counsel, and that sons shouldn't have to struggle to remember their mother's faces, and that grandchildren should get to know their grandparents, right? So working to preserve and protect people's health is so important, right? It's like I can't think of a better job. I'm so grateful for my mother to pushing me into this, and I'm grateful for those experiences that have continued to define how important this work is. So that's vulnerable, right? Being able to tell that story. And I've done it in different settings, and I've tried to keep my composure, and it doesn't always work. But I think that stories like that, the more that we tell that other side of the story and getting people to being able to share that really helps us better understand what the realities are in our communities. And the reason I put this half empty, half full is that Lori did a really great job of ensconcing in me the idea of a frame, right? Like when we're telling our stories, that we're putting this frame. And I think that for the longest time, what we've been hearing about some of these aspects of our work is just one side of this equation, right? Like the glass is half empty. There's so much injustice in our communities, right? And that the opposition is saying your glass is half full, and there's so much opportunity and choice in your communities. And the truth is that it's the whole story is the truth. It's both the advantage and the disadvantage of what's going on. And what we're trying to achieve is equity by really being able to say that everybody deserves a glass that's full, right? And so I think that helps me as I'm thinking of things like sugar sweetened beverage policy, that there are communities that have tap water, that's potable, and there are people who consciously make choices to buy sugar sweetened beverages, right? And that there is also, when we're using sort of a full brain, the diurnal thinking of there are people who cannot drink clean water out of their tap, and that there are not people who can afford to buy anything but sugar sweetened beverages because that's what they can afford, right? So it allows me to see the other perspective and to acknowledge that as real, and helps me to also say, like, the other side of that story is this also, right? So we have to see the full picture. And what we want is the same experience for those people who can, for those that currently cannot, right? So how do we get to that bridge? So I think that, again, we have to continue to work to help empower people and help people in their own language, in their own words, talk about what's affecting them and what they see also as the solution. And that's also a half empty, half full for me, because I have my ideas about what it is to promote health and good health. And there are realities of compromises that happen on the ground. And one example that I'll share with you is in Fresno, there's been a lot of work at trying to get safe places to play for children in Southeast Fresno. There was an opportunity to have a park ensconced. There was movement to get that park there. That park is right off the freeway. And our environmental quality advocates came out to say that's not the ideal place for a park. And of course, it's not the ideal place for a park. But the community wants a park, right? And the community is happy with where the park is, with just the fact that they're going to get a park, right? So do I continue now to sort of work against that by saying this is not something you should settle for, or do I support them in their efforts to get the best park that they possibly can, which happens to be by a freeway? Mm-hmm. So that diurnal thinking of I have to respect the fact that these are the people who are living here, and this is their desire that they want to see brought to fruition. And I've done everything that I can to help inform them about what could be sort of the not so good ideas about this park. And if they're still choosing to want to support it and move forward with it, then I have to accept that is their decision as well. So I guess the piece that I wanted to allow Brandie to speak to for a few minutes are just how this training and this information we are trying to spread and to help more people become involved in media advocacy locally. So in our recent curriculum, we did include a component to help more of the grassroots community members we work with identify ways where they could begin to exert their voice through media advocacy. And I think both by helping to encourage our partners and the residents, that we have begun to see more of a movement on the sort of articles and media stories or radio interviews that are sharing more of this perspective.
Yeah, so I can touch a little bit more on that particular piece. I did actually partner up with another trainer. We did this bilingually, and delivered a training in English and Spanish on how to be an effective spokesperson. And there was really a lot, I think, to that training, and we really had to sort of meet the community where they were at, and many of them had already those opportunities to speak with the media, but many of them hadn't stepped into some of even the basic things like the letters to the editor and the op-eds, and so they really did this from sort of a ground level, and the training did talk about some of the basic things like how to what are some of those components of being an effective spokesperson, what needs to be in your message. We actually did a exercise in that training on having the community leaders speak with a elected official, for example, and really telling their story and giving examples of the specific project that they were working on to make it a real life example. But we walked them through how to do a press release, and then shared a little bit about the importance of letters to the editor and op-ed pieces and how those can really help to leverage the work that they're doing. Some of the other things that we did also discuss was campaigns, and how local campaigns in the Central Valley were really giving groups leverage for the work that they were doing, and in particular Stockton, the group that we were working with, they were really interested in getting a grocery store cited in their particular community, and so they really wanted to hear about some of the work that had been done years ago in Fresno, and so it was really trying to bring those real life examples to the table and to share them so that they could really take away those ideas and be empowered to step into more of that world of media advocacy, which is what they were kind of doing, but just really helping them to advance. And so I'm really actually so proud of a lot of the work that the community leaders are doing, and Veva and other partners that we work with, the community leads, because I think with all of them together, we've built a really good synergy in the Central Valley. And I think having those different connections with the leads in our regional office, and then the community leaders, and of course the good connections with the media really helps us to move forward.
So I think we can open it up for questions or any other thoughts, but as people are thinking about questions, this was the part that I selfishly thought I could get some input on you from. So one of my other hats is as the chair of the Latino Coalition for a Healthy California. And some of you are aware that on October 21st, there'll be this beverage summit. And I am asked to speak on one of the opening plenaries to talk about the issue of how the sugar-sweetened beverage is affecting the Latino community, and to really help, I guess, be provocative in terms of really depicting how it is affecting us and what have been the health consequences as a result of it, but also to be helping to suggest how people can become involved, and why we need a soda tax, right? Like why this would benefit all of us. And the only reason I wanted to share this with you was that this was a short little piece that I did for a newsletter for CPEN. And it does, I think, have some of the ideas I think I want to carry forward, but I really want that to be an opportunity to be compelling, right? Like, the issue that's happening in my community is that there is this acceptance of sugar sweetened beverage as a beverage of choice. Some of it's historical because they've come from places where potable water wasn't available to them, and they've established patterns of sugar sweetened beverage consumption. That's not true where they live now in a lot of instances, but they continue that same pattern. But the other thing is, like, I can't think of any single friend that I have that's Latino in the Central Valley that doesn't have an aunt or their father or their grandparent that's died or been affected in some way by diabetes, right? So there's this effort, this need to educate them just about the detriment of so much sugar-sweetened beverage consumption, and then there's a need also to help galvanize them into action about mitigating their own continuing consumption, as well as what they can do in their communities, in their school settings, to help assuage that as an issue. So, yeah.
So can I ask you a question
Yeah.
about that, Veva? And it kind of goes to what you were talking about too, Brandie, and the trainings that you were doing. I think it's hard to do this. It's hard to tap into the vulnerability that helps people see what the real connections are and what motivates you. But it's also hard just because policy change takes a long time and there's such fierce opposition, particularly for something like one policy which could be a tax, and even policies about changing vending machines in schools or in parks. And Veva, you showed us your motivation clearly, and I think, Brandie, probably in the training, you see some of that too. And I wonder, what do you see that motivates people to keep on doing it? Like, do you see that in the trainings? And because I think that's part of it. It's not that there's some quick answer here. It's that we have to keep sustaining our momentum and growing it. And I wonder what you're seeing.
Yeah, I think it's definitely the same. I mean, some of the stories that Veva was sharing are similar. Much of the community, you know, for example, just going back to Stockton, I mean, they've gone years without a full-scale grocery store in their community, without having access to fresh fruits and vegetables, and so they're really, 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 you know, desperate to have a venue there that sources local produce. And they're frustrated. They're you know, when we did the training, they were definitely at that point where they wanted to do more around, you know, media advocacy. The story looks different. You look at the Burroughs neighborhood in Fresno at the time. They were really, really, really needing a safe place for their children to play. That was right around the time where they were able to start partnering with the school district there, or the local school, and form a joint use agreement that allowed those school gates to be open, and they're still open today, and allowed the community to come in and be physically active. So these are you know, those real life examples of those challenges that they're facing that do impact their day-to-day health. And that is where their motivation, that's where their dedication to the work that they're doing still today, you know, comes from, those day-to-day experiences.
So they're mad.
Many of them, yeah, frustrated, not sure why they have to live in those particular situations where they don't have the access to fresh fruits and vegetables, but you go to, you know, the north side of the town and it's easily accessible, you know, so it's that inequity.
Do you have questions?
I guess it's, so this is such a, you know, thank you so much thank you both so much for coming and sharing about some progress and some real, you know, moving forward that is happening, and coalitions are being built, and, you know, people rallying around. So it's really, for us, it's so good to hear about all the work happening, because like you both have acknowledged, there is so much work to do, but those little wins can make a big difference. That park, regardless of where it is, can make a difference. And having people understand that they can make a change in their community, not having people understand, but seeing the change in their community. So that's wonderful. For us, we do workshops different places, and when we work with young people, and sometimes there's the adults working with the young people say, okay, we really want you to have a focus on sugar-sweetened beverages, sugary drinks, it's a big problem. And the young people say, well, my brother was shot yesterday. Can we talk about that? I don't have a park. I don't have a safe way to get home. My school's horrible. We don't have PE. And they're very overwhelmed with this long list of things that they're dealing with day in, day out. And so it feels very forced to think about sugary drinks as an issue, because they're like, well, yeah, it's just, I know this isn't good for me, but I'm dealing with trauma. It's not post-traumatic stress because it's not over. So so how do you, in those situations, particularly probably with young people, because maybe they're not experienced, they probably have family members that are living with diabetes, but maybe they can't point to a close friend who's
right, yeah. No, I mean, I think that's really valid, and I think that you have to sort of honor people where they are, right? And maybe they're not going to be the spokesperson for sugar-sweetened beverages, but if they're really passionate about that violence and that crime, there's still this capacity that can be supported in them, that maybe when they're ready to talk about sugar-sweetened beverages, that they have some experience to draw from in terms of how they were talking about this, or how they help to inform people about sort of those crime and violence aspects. I think anytime we help to support someone's capacity, even if it's not on our exact issue, it's still a benefit for us in the long run to have more people being able to tell the stories. I think with the sugar-sweetened beverage issue, I like you have not had a whole lot of experience where I've seen just kids be like, this is the issue I want to be involved in. But we have had some successes in school settings with kids that have worked on things like the snack shack, they've changed policies in terms of what is being sold on their campus, or they have a healthy shack for after school events. So there's been some, and I think that, you, like any issue, you get the people that are interested in the willing, right? It's a lot of energy to try to convert and persuade people that aren't, right? So let's not focus there. Let's work with the people that are. Even when I talk to sort of elders in my family, and I'll give you guys this experience. The last Sunday that I went to church with my husband, this church is always talking about different fundraisers that they can do. And this time, it's the House of Love, and it's Pastor C.L. Hutchinson, who is our pastor. I was born Catholic, right? Born and raised, but my husband's a Church of God in Christ. And so he says, we're going to sell sodas as part of our fundraiser, and we're taking up a special collection to help purchase the sodas for the fundraiser. And my husband turns to me and he says, give me that $5. I'm like, no. And he's like, no, I'll give you the money back later. Just give me the $5 for the collection. I'm like, no, I can't let you nor I contribute to this, right? And I'm like, I'm so animated about this. I'm ready to stand up and do a testimony, right there in church, to tell everybody, no, we have so many of our congregation that has diabetes, and this is not what we want to do, right? And Keith's kind of he can see me getting excited. He's like, no, it's going to be okay. So so the pastor goes on, I'm hearing him talk, and he says, part of the reason that they want to sell sodas is because he's against the idea of selling water. And the reason he's against the idea of selling water is because God made water for all of us, that we shouldn't sell it, that it should be free and available to all of us, right? And I'm like, okay, that's something I can get him with. I'm going to catch him after church. I'm going to tell him, you're absolutely right about the water. Let's take the donations to buy the water, and we give the water away, but they purchase the meal, right? Let's figure out a different way where we can do a little bit of fundraising for the church, but we're not compromising this value around we want to preserve the health of our church members and the community. And so I did. I went after to talk to Pastor C.L. Hutchinson, and he says, I agree with you. I do have a lot of people in my flock who have diabetes, and talk to the church moms that are organizing the event, and let's see if we can get them to change. I go to talk to Yvonne. Yvonne's Keith's cousin, and she tells me, I already bought the sodas. Aww. And I'm like, so I'm like, Yvonne, the next time we have this, we're gonna just do the water. We'll do flavored waters. We'll do teas or something, but we're not gonna do sodas. And she's like, okay, next time. And then I was thinking like, oh, I'll just buy the water myself and give it to them. And then I'll do like a pour out with their stuff. Like I'll take that stuff they've already bought and just like video myself like pouring it out, you know, like House of Love, you know, at the curbside, you know. I haven't done that yet, but maybe. So yeah, I think it's like, there is support. Like people do understand these connections, and sometimes it's just helping them practice it, right? Like helping them see, like, of course we have this issue in our community, and I need to be a force or a part of changing that issue with, you know, my practices in the church or in the school, or you know, even in my own family gatherings, right? Like, how do we support that?
Thank you, Brandie. If you do the video, we'll put it on our YouTube channel.
That would be
Yeah,
amazing.
yeah. I'll do it with all the kids.
Other questions?
Yeah, I have a question.
Yeah.
I had the opportunity to give some testimony to California Senate panel with Senator Belmonte, who sponsored the Senate tax bill most recently, as well as Senator DeSaulnier, who I was really impressed with their knowledge about public health issues. And with Lori's help, I was able to include a really personal set of stories about the birth of my son and all of the public infrastructure and public health policies that operate in the background, you know, and trying to get into that idea that when public health works, we don't see it, right? But like to make it visible, to help re-energize public faith in, you know, our government and our institutions. And it was really interesting that the feedback I got was positive, but I was still challenged by these senators to also be thinking about sort of costs and nuts and bolts. And so my sort of takeaway was that the personal testimony, you know, because oftentimes we encourage people to expand the frame, right? And but yet when you're in the policy context, you know, having that personal connection really drives home, like, why is this important? Why we need to act? But on this sort of like, is it feasible question, I was just interested to hear your reflections. You've been at this a lot longer than I have, and just maybe conversations and reflections you've had with policymakers, you know, who are interested in bringing over a more conservative colleague, you know, on a city council or something like that, who sort of maybe isn't as compelled, but if it's cost effective or whatever is going on in that community.
Yeah. I wish I had more positive experiences to share. I have been in situations where I've been talking to, you know, our congressman about prohibiting cuts to SNAP, and staffers and him, of course, support it. Like, we do not want to see any cuts. We want to preserve it. We want to restore it. But then there's this political pressure from others around, like, we have to reach some compromises in order to get this to pass, right? And so I understand why they do that, but I think that it's a shame that they're not responding to the real issues in their communities, right? Because, you know, this is the same guy who's going to oppose it, will speak about opposing it, but then when it gets down to the vote, he's going to make the vote because he thinks that he can keep his political capital for some other thing, right? Like, this is not what he's willing to go to bat or, you know, die over. So, I mean, I think there's just realities like that we have to be conscious about that are happening, and how do we help support him by, you know, that one champion that's there, how do we help support them by bringing the more voices, or, you know, helping them ensure that there is robust support for this from the community, you know, and bring those community voices. So in you know, the city that I live in, I've been trying to work with decision makers there about passing a healthy eating, active living resolution, and I have one council member who's you know, willing to support me, and he's probably going to submit the resolution pretty soon here. We've been fine-tuning it so that it's something that's palatable and agreeable, and I've been trying to preserve as much as I can to it. But part of the reason he got to that position was because it wasn't just hearing it from me. Like, there was more people coming that were saying sort of the same things, and, you know, expressing the same desire about safe parks and, you know, complete streets and air quality issues as well. So I think that's what eventually helped him, and now I'm hearing like more agreement from the others, and I know he's been talking to some of them as well. So I do think how do we help deflect some of the issue for them, and then how do we really help to bolster, like the political will that they're seeing from their constituents around those issues helps them. I think if they're only hearing from, like in the Fresno Unified School District example, they had this contract with the dairy on their flavored milk, and they were hearing from him. The school board I'm speaking to was hearing from him. They were hearing from their nutrition service director about, the kids' consumption of chocolate milk and their preference for chocolate milk. And then we had this 700 parent petition against like getting flavored milk out, and we had a lawyer who was a parent come to speak. We had a PE teacher, retired PE teacher, speak in favor of removing it. We had a bariatric surgeon come. We had a Spanish-speaking mom come, and we had gotten them to the point where they were really questioning, like, hey, there's a lot of community interest to get it to change. We got a lot of media. We had people holding signs with like the no flavored milk. And then what happened was that somebody made this suggestion that they have a broader community input process. So they decided to develop a questionnaire and ask parents if they really wanted to have chocolate milk removed. And the way that questionnaire was set up, unfortunately, is that you could go in and log 700 times one person and respond no, right? Like they didn't do it in a way that was really sound or scientific. And so then they had their evidence like, hey, a small minority supports the idea of getting it removed, and we have all these people who are saying no, And so that it worked against us, right? Like in the final analysis, we lost the momentum of the presence of the community support for removing it because, this undercut us. So I can tell you that there's a lot of value in, had we continued sort of this bolus of presence of a majority and a lot of people and sort of people that were seen as authorities speaking to the importance of this, then I felt we could have tipped it more and we could have kept it going. It was hard to counteract once they had that survey and they were saying, nope, we got 1,000 parents. Yeah.
Yeah, I have some comments. My name is Lizak. I'm new to the team, and I recently came from Chile, where I lived for a long time, and I worked for a long time on tobacco control, and I worked both at the very grassroots level and also at the national level, and just drawing some parallels between what went on in tobacco control and what's happening in sugary drinks. It is never easy to motivate people about the possibility of getting cancer or I imagine diabetes. But two things work for us that I was surprised to see. A friend of mine always said that righteous indignation is a really great motivator, and somebody mentioned that word now. But you in your letter, you say that the industry cares about their profits, not your health. That was no news to anybody in Chile, and especially Chile, which is very neo-conservative. But the idea that the tobacco industry was setting public policy made people very angry. So profits, that's what businesses do. But they're determining and when I hear some of the numbers that you guys talk about, how much the industry spent so people who were not in favor of tobacco control in any way and never intended to give up smoking were actually quite upset, and it brought in a whole series of players we were not successful in bringing them in, but we had hope, and we got at least some attention on the issue of corporate abuse, which is not the situation here. Those people, I think, are already behind you, but that was actually very motivating to just normal people. Not that the industry made profit, but that they were determining the policies. And the other thing that strikes me, having come back to the States also, is an issue that I don't see addressed, but is a huge collateral issue that to me would seem very inspiring to youth, is the garbage, the quantity of bottles. That is such a huge issue. And when we actually attempted to look at cigarettes through, we're talking about 700 cigarette butts at your bus stop. It was another way. And I'm just curious if people really rally around the garbage issue. I mean, imagine a school. Imagine just look into your school wastebasket. Instead of seeing the thrown out lunch, you've got 700 bottles. plastic bottles. Like, I'm curious if those are strategies that people are using, if they've been useful.
Yeah, I mean, I do feel that issues about the environment are much more in the consciousness of our youth than I can ever remember, even myself, like being worried about, right? Like, I think I was worried about nuclear war more than, the environment. But yeah. But can I point to like a place where there is so much like litter and that it's affecting their everyday sort of activities? Not too much. There was a few photo voice projects that we engaged in, and the youth that we're talking about sort of those aesthetic issues, we're talking about them in context of their alleyways, right? That the alleys weren't clean, and that this uncleanness made them feel unsafe. And and when I say unclean, it was like there was like sofas, and there was tipped over trash cans, and there was mattresses just being like this dumping that you typically see in like an alley area. But I can't say that like in vacant lots there's bottles or there is, sofas. Like in the Valley, I don't see that so much in context. I mean, I won't say that you can't drive a country road and find a mattress dumped somewhere. Like, yes, but is there a bunch of bottles or water bottles or things like that? That kids that I've heard, no, not necessarily. But
you mentioned predatory filtration systems marketing, and one of the things that we've been kind of interested in following up on is the bottled water marketing, right? Kind of similar to how your pastor said that it's really selling a product that should be available to any, not even a product, in essence, a necessity.
Yeah.
And one of the things that's really interesting to me is especially the marketing in Latino communities, because so many people, again, come from backgrounds or countries or communities where water isn't potable, it's not an option. Sugary drinks are just ingrained as a way of life, as what you drink. Porque el agua no es seguro, right? And so that's been a really interesting issue, but it doesn't seem like it gets a whole lot of traction. Occasionally we see a little bit about, in a blog or a newspaper or something, somebody's talking about that, but not really a lot of talking about the fact that this is a really racist form. And this is absolutely not just predatory, this is racism. This is basically preying on the fears of a population and the culturally ingrained fears of a population that are based in, colonialism and all kinds of unsafe conditions that are created in their home countries and then brought into them here. And a lot of those bottled water companies are owned by soda companies, Dasani and Pepsi, all these things. Yeah. So is this at all, it's something that I get really angry about it. I get so angry about it when I see it, and I get righteously indignant, and I'm furious about it, and I think we should all be angry about it. It makes me so angry as a Latina, as a person in public health, as anything. But is that something that people are getting? Is that, have you had any kind of luck or traction kind of building around that a little bit?
Yeah. Well, I mean, last year we had the human right to water passed, right? And one of the groups that's been doing a lot of work around water in the Valley is Community Water Center. And they're very, very good. And so so I think that they've done a phenomenal job about helping more people understand the injustice of communities paying a water bill for water they can't drink, and so I feel like the issue is getting much more attention, and what I'm seeing happen as a result of it are things like local Rotaries now want to help buy filtration or donate filtration systems for some of these communities, and so there was a pilot project that they have going on there. Part of the issue with why maybe there is not enough public outcry about this is because the people living in those communities that have these water challenges are often undocumented, right? And undocumented individuals want to be in the shadows. They don't want to be in the limelight. They don't want to be identified where they live because for fear of deportation and things like that. So it becomes difficult to galvanize enough sort of synergy where you get some spotlight on it with enough of them. One exception for me is Fairmead. So Fairmead historically was a largely African American rural and incorporated area in Madera County, and the new sort of demographic shift, much more Latinos. But there was still like this older core African Americans, very outspoken, and they had issues with their water systems to the point where they would have dry days. Like you turn on the water, no water comes out. Sewage just broken, right? And they would self-organize where with the church, they would go out and buy water and give it to their neighbors, right? Because they knew like nobody was having water coming out for these days from their faucets and stuff. Well, eventually what happened was that they organized themselves to begin to talk to the board of supervisors about like, you have to fix this. Like we're, part of the county, you're our local governance, you have to invest in getting this done. And when it was just like, a few elderly African Americans out there at the board of supervisor meeting, like, okay, 4 Black people complaining from Fairmead, right? When they started to build relationships with the Latinos who were in the same boat with them, and then you had 50, Latinos with African Americans, and then that got the attention, right? Like, so again, like, I think there's a lot of importance in being able to make those connections and build those allies and get people organized, saying sort of the same thing, like we deserve to have access to water, we're paying taxes, you need to fix this, right? And eventually what they got was water, I'm sure it's not the right word, but it's a water tower. So basically it keeps enough water in it so that they won't have dry days. It doesn't completely fix all the water infrastructure issues that they have, but at least that they have, water coming out their taps. I think similar to that, like if we could get more people, allies and supporters talking about how it's not right that my neighbor, even though they're in their next town, can't get potable water, right? Like we need the county to help resolve this, or the local city, or whatever it can be. I think that would be great to support that more.
It also just seems like an interesting something like an avenue into the conversation about sugar drinks, because as I said, so many of the companies that market, that are profiting from it are the same ones that are also you say, oh sure, absolutely, you should drink water, we sell you, and that's kind of the mentality. And so I don't know, I was just thinking about the question of like, how do we make that interesting and resonant to people who are dealing with issues that maybe seem who have other concerns, right? For whom this is not their major issue.
Well, along with the filtration system, so the other businesses you'll find in the valley are the water mill stations. And so those are the water mills that are connected just to your public water, but people will go and pay to get the 5-gallon jugs filled up at these water stations, because again, they feel like somehow they surely must be filtrated. This surely must be better water than what's coming out of my tap. But in fact, it's the same, and someone's making a business off of selling that public water,
So these are in homes where they have water all the time?
These are in cities, like Tulare has water quality is fine, and there's a windmill station. So they're like self-serve water stations that you pay for. Yeah.
And I mean, even at Safeway, you can get your water, I'm always surprised whenever I see people getting their giant things.
I figure they're going camping.
Yeah.
Well, Bella, thank you very much.
You're welcome.
It's you can see why she's an award-winning media advocate, and the things you made me think about are some of the things we talk about all the time with media advocacy, but you made me think about them in a new way. And one of them was relationships, and it's really clear. I mean, the last story you just told about water and African Americans and Latinos in the Valley coming together to demand what by rights the government should be providing for them, that's dependent upon relationships. And the fact that the names of the health reporters in Stockton and Fresno and at La Opinion, that's about relationships. And the fact that you are connected, not just that we're connected now over years of trying to figure out these hard questions together, but that you and Brandie are connecting that to people that you're working with all over the Valley. Those relationships are so important, and they're the sinews of trust that allow the other thing you talked about, which we don't hear that much in media advocacy, which is vulnerability. And and you braided that together and made that so powerful. And the more that you help other people do that too with their own stories, it's the I was going to say it's the weapon we have, but I don't like that metaphor. You know, you know what I mean? I wish I had a better metaphor, but it does feel like a war sometimes. Yeah. In part because it's so prolonged, but it's where the power comes from. You didn't, your word up there is love and peace. Oh.
So this, I wanted to.
I can't bring my weapon and talk about that.
So I was watching your last Brown Bags, and one of them was Pancho. Yeah. Pancho's one of my heroes, right? And he had you guys do this activity of. So I was going to segue like from Pancho's conversation that this was Veva, right?
Oh, there you go.
Love, peace, vivacious, Mexican American. And so that's what that was.
Okay, that's good.
Yeah.
I like that.
But I agree with you because I've been in Senate hearings or I've been on conference calls and I've been trying to figure out like how do I say without saying fight? Like I want people to join this fight. Like this is your fight. If you believe in equity, this is your fight. Like if you believe in that Latinos shouldn't have to experience this high burden of diabetes, this is your fight, right? Like what is the but not saying fight or, I don't know. Yeah.
That's what I always go for. I always say struggle, but struggle.
This is your struggle. We want them to win. We don't want them to struggle. This is your victory. This is your potential victory. I don't know. Like,
Well, it's the way we're making a difference, and it's clear that the California Central Valley is much better off for having you there. So thank you very much.
Lori. Thank you.
Thank you.